Is it really overweight or just baby fat and muscle? Maybe BMI flagged your child as having overweight or obesity, but they look totally fine to you. Here's when to trust the number and when the number is maybe missing the point. My name is Dr. Natalie Muth. I'm a board certified pediatrician, registered dietitian, and obesity medicine specialist. I spent 13 years in pediatric primary care where I founded a healthy weight clinic and had thousands of conversations with children and their families about weight, healthy weight, nutrition, activity. I pivoted to found Namio Health so that I could help even more families have deeper conversations and get extra supports to help optimize their health, their family's health, and their child's health. Today, I want to tell you a little bit more about BMI and what to do about it. So BMI stands for Body Mass Index. It's often used as a quick measure based on someone's height and their weight to be able to identify if there's a concern for overweight or obesity. In pediatrics, we look at a child's height, their weight, their age, and their gender to get a BMI percentile for age. If the BMI percentile for age is above the 85th percentile, it's considered overweight. And if it's above the 95th percentile, it's considered to be obesity. Within obesity, there's other measures that are looked at the very high levels to be able to better understand how severe the increased weight is, which can help direct treatment. But let's get back to BMI. Does it tell the whole story? Well, BMI is just a quick screening measure. It's not the diagnosis in and of itself. So as I mentioned, it's based only on height and weight. We aren't able to actually measure how much body fat there is or a degree of what we refer to as adiposity based on a height and weight measurement alone. However, I should share and say most of the time the studies have played out when they've looked at BMI and been able to measure body composition or adiposity, body fat. It does play out that almost always when children have a BMI greater than the 95th percentile, they do generally have increased adiposity or obesity. So most of the time, the BMI is actually a pretty good measure for being able to identify if there is a weight concern in a child. Now, studies have also found that even sometimes when a child is thought to have a normal weight or have overweight, that body fat measure can actually be high enough to make it even more concerning than what we think based on a BMI measure alone. So, all to say, we shouldn't dismiss the BMI. Most of the time, it's actually quite accurate. Now, occasionally, if you have a child who's very muscular, or often this will be adults who are very muscular, sometimes it can lead you astray. But for the most of the time, for the most part, it is a pretty useful tool. But we want to use it in the context of the whole child and what their growth chart has looked like over time. If their BMI percentile has always been at a particular level, then that is a little bit less concerning oftentimes than if there is an increasing trend in the BMI percentile over time. So really, you want to have a conversation with your child's pediatrician to better interpret what their specific growth chart and BMI means. Now, if your child does have a BMI that's greater than the 95th percentile, usually that will trigger getting more evaluation done, like labs. So oftentimes with that elevated BMI percentile, we look at things like cholesterol, liver test, blood sugar, blood pressure to get a better sense of if there are signs of other health concerns right now that are often associated with increased BMI. This information is helpful because it helps you to be able to direct what your next steps are going to be and get a good idea of what your child's metabolic health is today. If the labs are all normal, that's reassuring versus if there are some abnormalities on the labs. However, to note, recent studies have shown that even kids who have normal labs now but have elevated BMI percentile, they do tend to go on to have abnormal labs in the future. So early intervention is the key. Part of why I love pediatrics so much, because there's such an opportunity to be able to make a difference and support children when they're quite young and help prevent some other health harms really that can come over time. So take that measure at what it's worth, for what it's worth, at what it is. All to say, the BMI percentile isn't perfect, but it is a useful tool to use in a clinical setting and to understand as a parent. And when you know your child's BMI, it can help direct you towards next steps. So I encourage you, don't delay in getting that extra support that you need. But also remembering that growth trajectory matters just as much as the current number. So you really want to have a sense of how your child's BMI percentile has been looking or changing or not over time, and ask your child's pediatrician to help you make sense of what all that means. Hopefully this helps, but certainly I would love to hear your comments. What is your thoughts about BMI? Have you had conversations with your child or your child's clinician? Drop your thoughts in the comments. I'd love to hear from you. Thank you.